Dear friends, welcome to Kheteswar Mansarovar Hospital YouTube group. Today I will discuss about the advantage of the robotic knee replacement against traditional knee replacement. Knee replacement surgery is in existence for more than 40 years and day in and day out newer technologies are coming up. In the latest time, after the navigation, robotic technology has come. As against manual technique, the robotic using CT scan and AI operated surgical arm assists the surgeon. Actually, the surgery is being performed by the surgeon, but the robotic arm helps in deciding the precision of the various cuts, bone cuts, and putting implant precisely over the bone. With the robotic knee replacement, the surrounding tissue damage is minimum, bleeding is minimum, and precision of the joint application. Implants are fitted very well and patient has early better recovery with long-term results for 25 to 30 years. Now with the increasing demand of technology and increasing demand of the patients in favor of robotic technology, we have adopted robotic assisted knee replacement and hip replacement surgery gradually and adapted recently. Even for hip replacement by robot is better and long lasting as compared to manual technique. Proper tourniquet is applied over the thigh to prevent the bleeding during the dissection and operation. Proper painting and wrapping is done. Knee joint is open by anti-approach. The joint is open, bones are exposed. First part is putting pins in the femur and to decide the dotted line suggests the pin is applied on the femur, which is various cuts are decided on computer and putting pins accordingly for accurate information and acute degree of getting full flexion.
Tibial cut. I hold the trigger.
ફીમર કટ કર્યા પછી ટીબિયા કટ કરવાનું હોય છે. જેમ બોન કપાતું જાય એમ સ્ક્રીન પર બી આપણને પ્રિસિઝન દેખાય. We can exactly precisely check how much cut is made. બોન કટ્સ કર્યા પછી આ રીતે બોન સિમેન્ટ ઇઝ ટુ બી એપ્લાઇડ on the cut and it has to be pressed very hard. Various components are fixed, tibial, femoral. ઓપરેશન થિયેટરમાં robotic assisted surgery requires special instrument and trolley like this, and we start the surgery by putting incision over the knee joint, cutting skin, subcutaneous tissue, and once it is cut, we will show you robotic assisted total knee replacement, which enhances the surgical precision and alignment. It follows the same basic principles as conventional TKR, but with the robotic technology for better planning and execution. Before we actually go for surgery, we have to plan the various cuts, and for that we have to do pre-operative planning. Proper CT scan or MRI 3D model of the patient's knee is created from the pre-operative images. Virtual surgical planning is done for various bone cuts, alignments, implant sizing and positioning using the software. So this is the computer which helps in planning how to do robotic assisted surgery. This will assist the robot in performing the various steps of the surgery. These are the various parts of the robot which help in planning the surgery. These are the various arms used for during the surgery. These are the various arms using pins are applied for measuring the cuts. Over the computer, the cuts are prepared like this gradually. First of all, point referencing is done using this pin, which shows the over the computer the dotted lines to mark out the various cuts. So we prepare the computer for making various cuts accordingly. So the precision is best using the pointer. Same is done. Femur also planned accordingly. After proper planning and putting the various devices, it helps in using the saw blade, it helps in cutting the bone. Point referencing is done. We can actually see cut on the computer also. In the saw, computer assisted saw, we plan the cut accordingly. So we cut the bone actually using the saw, and the complete precision is done with this. If the saw go out of the bone, it will stop immediately. Thus it avoids the soft tissue damage. So cuts are prepared like this. Tibial is fitted. The femoral condyle is also fitted like this, and the whole joint is repaired.